Hello and welcome. I'd like to thank the Northwest Montana Physicians Group for putting on this presentation today, and we will be discussing meaningful use security from a technology perspective. I would also like to thank Steve Pearson, a security expert that helped in the contribution and helped contribute to this presentation. So a little bit about me. My name is Andrew Eckstrom. I am the owner of a computer consulting firm. We provide IT services to small and medium-sized businesses. We're basically a rent and IT department for businesses that don't have the resources to bring an in-house IT person in. I bring 12 years of experience in the information technology industry, serving in various different industries. We have medical, we have engineering, manufacturing, mortgage, architectural, construction. If it's an industry, we've probably touched on it, which is great because it brings a lot of focus as far as the different types of industry requirements, but also the similarities that each industry has. My wife Jenny and I, along with our 2 small children, live in Whitefish, Montana. So today we are going to discuss meaningful use, the HITECH Act, HIPAA, and how these 3 pieces of legislation affect your practice. So meaningful use is basically an incentive program that was designed to help encourage the use of electronic medical record systems. And HITECH Act is the legislation that helps increase the legal ramifications for not complying to protect your electronic health information. And then HIPAA are the guidelines on how to protect your electronic protected health information. So we'll discuss who's responsible for meeting these standards, the cost for not meeting these standards, and how to apply these standards in your practice. So please be aware this presentation shouldn't be considered legal advice. The information in this presentation was collected, condensed, and distilled strictly for the ease of disseminating this information in a quick format for a large audience. So EPHI, Electronic Protected Health Information. This is where it all begins. Everything that's in this presentation, and really the whole medical industry right now, is focused on electronic protected health information. This is the information that contains patient identifiable information such as names, addresses, social security numbers, birth dates, patient charts, progress notes, billing information. Basically, if the information was produced, was saved, was transferred or received in electronic format, then it's considered EPHI, Electronic Protected Health Information. So now we have sensitive information that's in electronic format, and it became evident that that information needed to be kept safe so patients' privacy wouldn't be disrupted. And the way they've done that is through the federal government has done this is through several acts of legislation. Today we're going to focus on 3 areas. Specifically, we're going to talk about meaningful use and how that provides a series of measures to protect EPHI as far as from a technology perspective. We're going to talk about HIPAA and how that provides the standards and requirements to protect EPHI. And then the HITECH Act, basically, that defines the legal and technical requirements of HIPAA. It sharpens the teeth, as far as you might say, for HIPAA, and increases the legal ramifications that HIPAA can bring upon a clinic. So, who's eligible for meaningful use? You're probably saying, well, that's not me. But it is, actually. If you're a clinic with a medical doctor, a doctor of osteopathy, you're a dentist or a dental surgeon, you're a doctor of podiatry, you're an optometrist, or you're a chiropractor, you are eligible for the Medicare section of the meaningful use legislation. But if you don't have enough Medicare in your practice percentage-wise to qualify, you might qualify for the Medicaid plan, which you can be a physician, nurse practitioner, certified nurse midwife, a dentist, and a physician assistant in certain circumstances, such as in a qualified health center or a rural health clinic. So where do we begin? Well, You can't really talk about meaningful use stage 1 or stage 2 without starting at the beginning. And really, the security of meaningful use stage 1, stage 2 starts with HIPAA. So, what is HIPAA? Well, HIPAA is the Health Insurance Portability and Accountability Act passed by the federal government to protect the electronic protected health information of patients. So, well, what is HIPAA? HIPAA consists of several rules. The primary rule is the security rule, which we'll be touching on today. The security rule deals with electronic protected health information, how to keep it safe, and how to manage the processes and procedures that you need to keep electronic protected health information safe. So the HIPAA security rule has 3 safeguards: the administrative safeguards, the physical safeguards, and the technical safeguards. So, who's a covered entity under HIPAA? And if you're saying, well, I'm too small, or that doesn't apply to me, unfortunately, that's probably not true. If you keep electronic protected health information in any way that's produced, saved, transferred, or received in your clinic, then you're a HIPAA covered entity. So examples would be if you have an electronic medical record system, an electronic practice management system, electronic scheduling, or even if you have Word documents of patient charts on a laptop. If you dictate with a program like DragonSpeak or a dictaphone software program that creates a sound file, this is all electronic protected health information. And as you can see, you're most likely a covered entity. So healthcare providers, healthcare plans, and healthcare clearinghouses have to watch out for this. So, to dive right into the safeguards, our first safeguard is the administrative safeguard. And basically the administrative safeguards provide a framework for you to be able to develop, implement, and maintain your security management process. So, this is where almost all the processes and procedures are developed. It deals with the risk analysis. So, in a risk analysis, what you're doing is you're defining where your EPHI is located in your organization, all sources of it, if it's the medical record, the practice management system, scheduling, laptops with Word documents, and so forth. You define all of that. And once you've defined where the EPHI is located, then you have to extrapolate what threats are potentially going to damage or breach the security and the privacy of that EPHI. So, once you've defined where the EPHI is and the threats against it, then you have to come back and you do your risk management process. And the risk management process basically is a process by which you correct and mediate any threats to your EPHI. So if you have a threat such as you don't lock your front door of your clinic at night, well, in your risk management process, you would come in and you develop a policy so that the last employee to leave the office locks the door at the end of the night. And that would mitigate, or that would correct that threat to your EPHI. Now, there are times when you aren't able to actually 100% solve or correct a problem, so you're going to have to mitigate it, which means you have to reduce the level the threat has against your electronic protected health information. And so you do that during the risk management process. The third part of the administrative safeguards are the workforce security processes. And so in this section, what you do is you determine who should be accessing your EPHI. Does that mean that your front office staff that's doing scheduling should be in the EPHI? Does it mean that your billing staff should be in the EPHI? You determine who in your office, job functions or people, that need to be in EPHI. And then once you've determined the people that need to be in there or the job functions, then you need to specify what portions of the EPHI those specific people or job functions can access. So, in the example of the front office worker, you probably don't need Sally front office worker accessing the sensitive charts of a patient that has, let's say, a mental health illness or a communicable disease that would have a stigma in the community. So Sally front office worker might have a security level that reduces how much access she has to that information, whereas Jane Doe office manager might have access to everything because she needs to be able to deal with every aspect of the practice. So in the workforce security, you define who's going to have access to EPHI, and then you define what access those users will have to the EPHI. The last part of the administrative safeguards is the evaluation process. So a major thing, and I want to really get this across to everybody, is that in the HIPAA security rule, they want you to assess, they want you to correct, they want you to document, and they want you to evaluate. And then they want you to repeat, rinse and repeat as many times as necessary. So as you're evaluating, you've done your risk analysis, you've done your risk management, you've done your workforce security policies, now you need to go back and evaluate that. How often you do that is up to you. General guidelines are that you should be doing it more often than every 2 years. More than every 6 months is probably going to be a little bit onerous. So somewhere in between a year and a half is probably the sweet spot. And not only do you evaluate that, what your systems in place have done, and if they're effective or not, you have to document what you've done as far as your risk analysis, risk management, and workforce security. So you document your policies, your procedures, your logic as to why you went about doing those. You also then have to document your evaluation. So HIPAA, the HIPAA security rule, it really is comprised of neutral standards. They're best practices. There's no straightforward rule. So if you have someone coming in and there's been an issue, they want to see the logic behind why you chose to do something. And if the logic is flawed, then obviously there's a problem. But if you made good logical choices and your system unfortunately couldn't stand up to whatever the threat might be, then the auditor can see, well, you've made an effort, you made good logical choices, you just happened to have the perfect storm. So the second safeguard in the security rule are the physical safeguards. These are the safeguards that you put in place to control and protect your EPHI in a physical sense. So what you do is you have to evaluate every access method that is available to someone to get to your EPHI. Let's use an example. Let's say you have an electronic medical record system or practice management system, and it's on a big black server box somewhere in your office. That is where your EPHI is located. So wherever it's located, you have to control every physical access point so that your EPHI doesn't have threats against it. So if your black box is underneath the office manager's desk, well, there's probably going to be several people who have access to the office manager's office. There's potentially going to be the maintenance people have keys. The staff are going to be in there all day long, in and out. If the server is located in your server room, or in some sort of closet where you have a closed door, there's a key entry system, there's some method of tracking who's coming in and out of the room's air conditioned, you're controlling the access. So you have to think about all the methods that someone can get to your EPHI. I usually start from the outside of the building and work my way in. Every sort of phase I walk through. So you have your exterior building, your windows, your doors, your security systems, what's in place there. You have the interior of your building. So you have interior doors. Are they locked? Can anybody get through them? Does everyone have the same key? You have your elevators. Do the elevators shut off at certain times of the day? Are elevators restricted from going to secured areas of the building without a special passcode? Your computers. Well, are the computers in areas where your patients or the public can access them? Are they in lobbies? Are they in unmanned desks that are near patient areas? When the computers are exposed to the public, can the public see the monitor? Do you have screen protectors on your monitors? The wiring. So in your building, the wiring is critical. All information transits across that. Is your wiring secured behind walls? Or access points to your wiring behind closed doors? Are the data ports and the wall outlets in publicly accessible areas such as your lobby? And those ports that are not in the lobby, are they turned off when they're not being used? The other part of wiring is also the wireless networks. So do you have a wireless network in your office? That's great. Patients love to come into the office and hop on the wireless network and browse the web while they're waiting. It's a great service. Do you segment the guest network from the production physician network? Anytime a patient is browsing the web, that's an unsecured transaction or unsecured process. So you're going to want to make sure that you don't have any overflow from that guest network into the production network where the physicians or the EPHI exists. And then you have your things such as your mobile devices. The new thing is it's called BYOD, bring your own device. Everyone has their iPads, their cell phones, their iPhones, their laptops. They're bringing them everywhere, and they want to hook up to your wireless when they walk in your office. So are those mobile devices filtered so that they're not into the production network accessible or can potentially access the EPHI? This isn't just for the guests or the patients to come in, it's also for your employees and the guest visiting physicians or visiting providers. They really, unless their device they're bringing in has some reason to be on your production, your privileged protected network, you should really be filtering them out through the guest network also. Just generally they just want internet access. They don't need access to the EPHI. And then also your backup media. So now you have your servers protected in your server room. Where does your backup media go? Does it go off-site somewhere? Who takes it? Where does it go? Is it locked up when it gets there? Is there a record of who's taken it? Those are the things you want to think about as far as your backup media. So physical safeguards. Oftentimes it's really helpful to take your building facility manager and have a discussion with them about, okay, this is where our boxes, our EPHIs exist on this big black box called the server. What methods can people get to it? The third safeguard is the technical safeguard. And this technical safeguard, it provides methods to control the access, audit access, verify integrity, and transfer EPHI. So this is where it's very helpful to have some sort of IT professional who can give you suggestions on how to deal with these things. These are the safeguards that exist within the computer system. They're strictly settings, and there's some processes and procedures. So examples of controlling access would be that you have a unique username and password for everyone that logs in, or everyone that can access the EPHI. So an example, if you have an electronic medical record, every person in the office needs to have a unique username and password. The days of sharing the same username and password are gone, because if you all have the same username and password, it means you can't audit the access. So most electronic medical records have audit trails which will say user Sally front office was accessing the secured chart of mental health patient John, and she printed that off and then she emailed it to the local paper. So once again, you must have unique usernames and passwords. And then not only along with the unique usernames and passwords, you have to have it. You have to be changing the passwords on a regular basis. Usually 90 days is considered industry standard, and that way you can control who's actually logging onto the computer. Once you have the control of who's logging on, obviously, like I talked about, you have to audit it. Most of these medical record systems now have audit trails that you can print reports on. I would highly recommend that you first run the reports for small sections of time so you can see what you're looking at, and then do what we call manage by exception. Look at the reports that have users logged on at unusual times or unusual days. So run reports to see if there's anyone logged on from 7 p.m. till 8 a.m. in the morning. Anyone who logs on the weekends. If you have unique or specially restricted charts, run reports on who accessed those charts. And if you have any sort of exceptions that you would really want to protect, define those and then determine your audit policy on that. Otherwise, if you just start running audit reports, you're going to find audit reports with thousands of transactions that will basically be like trying to find a needle in a haystack. So if you know what the needle looks like, it's a lot easier to find it when you're looking in the haystack. As far as the other after audit, we also have integrity. So HIPAA requires that you can verify the integrity of the data, which means that when the data is being accessed or transmitted, that the information, the state it left, so the original state you had it and sent it in, is the same state it arrives in. And the computers and protocols and the computer systems usually deal with this, so it's not that big of an issue. But you should address it at the very least. Make sure you're using the right computer protocols to make sure your integrity is being met. And then, of course, there's the transfer of the EPHI between systems. So you could have a laboratory system in your office that's separate, and you're sending EPHI information between your medical record and your lab system. You have to make sure that that information is transferring securely. You could be sending EPHI between multiple clinics, or you could be sending it to like a regional health exchange. So you have to take into account the methods of how the information, the EPHI, is accessed, how it's audited, its integrity, and how it's transferred. Along with the HIPAA security rule, we have a couple of requirements. So these are on top of the safeguards I just discussed. These aren't usually very technical, but you have to know about them. So anyone that accesses EPHI, if it's an employee, you obviously are going to have a policy or a procedure that discusses the nature of accessing EPHI, that it's protected, it's private, there should be no reason they're divulging that information to anyone else unless it's related to the care of the patient. But you have sometimes outside contractors. You have IT professionals like myself. You have vendors, pharmaceutical vendors, supply vendors. You have building facility people. Anyone who can come in contact with EPHI needs to have a business associates contract or some sort of other arrangement. And basically this business associates contract just outlines the requirements that this contractor has for being exposed to EPHI, and then also the risks and the requirements they have for maintaining the EPHI and the process in the event that there's a breach. There are also requirements for group health plans, but we won't be touching on that in this presentation. Like I discussed earlier, HIPAA is all about assessing, remediating, proceduralizing, and evaluating. And as part of the proceduralization, you need to develop policies and procedures that your employees can use so that they know how to access EPHI in an appropriate manner every single time. So it's not like today they can look at a chart, but tomorrow they can't, and the next day they can. It has to be consistent policies and consistent procedures. So the best way to do this is when you're doing your administrative safeguards is to really think about who has access to EPHI, and you really think about what it is that they're doing in there. And then not only is it who has the access or who is actually accessing it, what do they do in the event that something wrong happens? So think about a patient has come in, they had access to a computer for too long. What's the policy for that? Well, we call on our IT security expert, we audit the logs, we verify that there wasn't a breach. What if there is a breach? You have to have policies and procedures for all contingencies. But not only do you have to develop the policies and procedures, you have to have them documented. So you should really have somewhere in your office a booklet of policies and procedures that is accessible to all employees. And then you need to document. So not only do you document your policies and procedures, you have to document why you chose to make those certain policies and those procedures. So once again, there's that logic path behind why you chose what you're doing. So now you know that you're a HIPAA covered entity. Now you know something about the safeguards that are required. What happens when you decide not to follow these safeguards? Well, there are penalties. And so the penalties can be monetary. There are lots of different penalties. I chose one here. You can be charged $100 per violation, up to $25,000 for each compromised record. So it's, if you have a clinic of 3,000 patients and you lose all 3,000 of those records, you better expect to multiply 3,000 by 100, and that's what's going to happen to you. You're going to be paying lots of money. Now, if you happen to have a breach that's less than 500 records, that's a magic number, less than 500 records, you have to notify the Secretary of the Human Health Services of the federal government. But if you have a breach over 500 records, you now have a public relations nightmare on your hands, because not only do you have to notify the Secretary of Human and Health Services, you also have to notify local media, local police, and you have to provide lots of protection for the individuals that were affected. So not only are you paying big money in your penalties, you now have a public relations nightmare on your hands where the local media is basically going to splash it across the news that John Doe medical practice is not capable of protecting the safety and privacy of their own patient records. And as you know, word travels quickly. It's very likely that a business that could not survive a change like that. Business would just evaporate the next day. So, eye and ear practice fined $1.5 million for security rule violations. HIPAA is real, and they're definitely auditing. The Human Health Services, CMS, is auditing people. They're going after right now the big boys, the low-hanging fruit, and they're making examples of them. But sooner or later, they're going to come knocking on your door. So don't assume that because you're a small clinic or that you're a single provider that you don't need to follow these things. So in this case, this eye and ear clinic had roughly, I think it was something like 4,000 records on a laptop that wasn't encrypted. So I'm going to tell you a little secret. Laptops shouldn't leave the office, and there's no reason to have patient EPHI on a laptop. There's really no reason to have EPHI anywhere but on your secured server. If you have laptops leaving the office, please stop that as soon as possible. I'll touch base a little bit further down the presentation, but the HIPAA Meaningful Use Security, Meaningful Use Stage 2, the only change to their security is that you have to require encryption on laptops, or you have to require encryption of EPHI when it's at rest, which means it's like a backup copy or an archive copy or a copy on a laptop. There have been so many violations of HIPAA security by people taking their laptops with their patient records. The laptop gets stolen, patient records are not encrypted, so now this robber, bad guy, Jeff the robber, he's got 3,000 of your patient records, all about the patient's social security numbers, their ailments, very private stuff. And he's deciding what he wants to do with it. Is he going to sell it? Is he going to do security fraud? Is he going to blackmail them? And so this has become such a huge issue that the body that governs meaningful use decided to add this special security rule because of laptops. So once again, do not let the laptops leave your office, please. And if you are, you need to encrypt them. And there's really, the remote access technologies are so readily available and so affordable. And if you have internet, unless you're living somewhere in the Antarctic, there's really no reason that you should have your EPHI leaving your office in a physical format. You should be remoting into your office and accessing it from the remote session. So now you've learned about now you've learned about HIPAA. So let's talk about meaningful use. So meaningful use takes the HIPAA security rules, the safeguards, and it expands upon them. So in HIPAA security, you can have those various safeguards I talked about have various standards, and they're either required or they're addressable. And addressable means that you can choose based upon your logic if you can implement them or not. And if you have logic that says you can't, and it's sound logic, then you don't have to implement them. But Meaningful Use has taken several of those addressable standards, and they've said to get Meaningful Use certification, they're now required. And so in the worksheet that we'll be discussing in this next slide, in this next video, you'll be able to go through and see the very specific measures of meaningful use that are now required. It mostly has to deal with the best practices such as access control, usernames and passwords, protecting workstations that are accessible to the public, but we'll go through them. They're not onerous. And then, like I said a little earlier, Meaningful Use Stage 2 really only adds the requirement to encrypt data at rest. So examples of that would be if you have backups that you're running, backups to tape, hard drive, thumb drive, or to an off-site storage location, you're going to have to, if you want to meet HIPAA Meaningful Use Security Stage, Meaningful Use Stage 2, you're going to have to encrypt that data. That means that either your EMR will encrypt it, your backup system will encrypt it, or you'll have a third-party encryption tool that you use. So that if that data leaves your office and for whatever reason it gets lost and becomes exposed to the public, you can tell HHS that yes, that data was encrypted, so someone's going to have to be sophisticated enough to break open the encryption to get access to the patient information. So that's meaningful use stage 1 and stage 2. So in this presentation, we gathered resources from several sites. We had these resources are what I'm going to be talking about with you in this packet. So we have our HIPAA meaningful use worksheet, and I'll go over that in the next presentation. And then we have the HIPAA matrices for the administrative, physical, and technical safeguards, as well as the matrices for stage 1 and stage 2. What these basically are just really nice like spreadsheets that CMS and HHS put together so that you know in a glance what measures and or standards are required or addressable, and a little bit about each of them. The meaningful use worksheet, HIPAA meaningful use worksheet that I prepared, which we're going to go over, is a summary of all of these things, and it also adds a little more detail as far as what questions to ask. And in this, like I was saying, in this presentation, we had several sources. So as you can see, we reference HHS, the Human Health Services, and then down below we have some meaningful use references. So questions, please feel free to contact us. We'd love to help you. You can email your questions to support@eckstromconsulting.com, or you can call us directly at 406-730-5105, extension number 2. I'd like to also present a special offer for anyone who's listening to this presentation, that if you, within the next 30 days, submit a request to us, we will come and give you a reduced price security audit. So our security audits usually are about a $500 charge, and we're doing it for $100. We see the need for security to be so critical in the medical field that we want to help as much as possible. So the security audit consists of us coming to your office, discussing with you what your security requirements are, where your EPHI is, reviewing your office for security issues, and then compiling all of those things, making recommendations, and coming in for a second interview where we discuss or we present all of our recommendations as far as how you can remediate and correct those issues. So once again, if you can get that to us within the next 30 days, you can have that security audit at the reduced price of $100 when it's normally a $500 value. And I'd like to thank you very much for attending this presentation today. We hope to see you soon.